Hey, my name is Nicole Smith. I'm a podiatrist here at Adena Health. I did my undergraduate training at Arizona State University in Arizona, and while I was shadowing a bunch of different specialties, I had met a general surgeon there who was doing a lot of life-saving procedures on patients, skin grafting them after encountering really serious burns. I had really enjoyed the work and learning from him, and he introduced me to one of his colleagues who was doing limb salvage work in southern Arizona in Tucson, and shadowing Dr. David Armstrong down there. He was a podiatrist who would have patients coming internationally and even in the US for life-saving procedures where they were told by other doctors they were going to lose their toe, they were going to lose their leg. So it really inspired me to help patients to stay on their limbs and be active. The opportunity to work for Adena had arisen where I came out here, spent some time with the staff that was working, and really found a good fit. I grew up in a very small town, and I knew I wanted to return to an area that was more small town feel. I keep saying small town because it just is embedded in my life that I've started there and I want to end there. We have every specialty that can treat patients from head to toe. It makes for ease of access for patients. They shouldn't have to go all the way up north or all the way down south to get appropriate levels of care. We have it in-house. I think it also helps with continuity of care. If patients can seek treatment and care here within the hospital, we're able to speak with their other specialists that may be treating them, and it best helps with patient outcomes. We want the best for all of our patients, so if we can treat them and do everything, it makes the most sense for them to stay. I treat patient care as a team-based approach. I want patients to feel comfortable when they come to me. I want to feel like their concerns are being voiced, their questions are being answered. I always tell my patients, I'm not just treating their concern at hand, I'm treating the patient as a whole. What is the best option for them and what is most compatible with their life? I've really picked up on the festivals here. So I learned about the Apple Festival, I learned about even like the Circleville Pumpkin Show, so enjoying those areas locally and meeting people in the community. I appreciate the community welcoming me here, and I look forward to treating well. I love spending time with my family, my friends, love traveling, love trying new places to eat, and just to know a sense of the community here, getting embedded in Chillicothe. I also work down in Jackson, so just trying all the new places, seeing all the new faces. So as a podiatrist, it's critical as we're treating foot and ankle problems to keep patients on their feet. So when I see a patient and they are in pain, I want them to be pain-free and I want them to remain active and be on their feet. I think the biggest problem is when patients don't know what is causing their pain. They come in, we get it addressed, and we keep them active. That is the most important thing for me, to keep patients active.